Hello, everyone. My name is Dr. Rebecca Parr, and I wrote an article called Targeted Physiotherapy for Pregnancy-Related Abdominal Wall Neuropathy. This was submitted to the Journal of Pelvic Obstetric and Gynecological Physiotherapy and is coming out in the spring of 2025 issue. Abdominal pain during pregnancy presents a diagnostic challenge due to its wide range of potential causes, from benign musculoskeletal conditions to severe visceral pathology. This case highlights a lesser known but clinically significant condition, pregnancy-related abdominal wall neuropathy, otherwise known as PRON, which results from nerve entrapment in the abdominal wall due to mechanical and physiological changes during pregnancy. Despite undergoing extensive medical evaluation, including imaging and laboratory tests, many pregnant individuals with persistent abdominal pain remain undiagnosed or misdiagnosed. This case underscores the importance of neuromuscular assessment in pregnancy-related abdominal pain and demonstrates the efficacy of targeted physiotherapy in managing PRON. For this case, the patient was a 23-year-old woman at 24 weeks gestation. She presented with persistent left-sided abdominal pain that worsened over several weeks. Her pain was sharp, which was exacerbated by abdominal muscle contraction and significantly impacted her ability to perform normal activities of daily living, including childcare and household tasks. Despite negative imaging, normal laboratory findings, and no signs of visceral or obstetric pathology, her pain persisted. Examination findings included localized tenderness, hyperesthesia along the left lateral rectus abdominis, reduced myofascial mobility, and a positive Carnet's test, strongly suggesting a neuromuscular pain generator rather than a visceral cause. PRON, a potentially underdiagnosed condition in pregnancy, occurs due to nerve entrapment at the lateral border of the rectus abdominis, where the lower intercostal nerves make a sharp 90-degree turn to enter the anterior rectus sheath. These nerves can become compressed due to scar adhesions, mechanical strain, or postural changes associated with pregnancy, leading to persistent abdominal pain, hyperalgesia, and muscle spasms. Given the patient's history of a previous laparoscopic appendectomy, scar tissue restriction was hypothesized to be contributing to nerve irritation and myofascial dysfunction. To accurately identify the source of pain, a thorough differential diagnosis was conducted and was described in depth in the manuscript. The positive Carnet's test and the localized tenderness supported a diagnosis of PRON due to anterior cutaneous nerve entrapment. The physiotherapy intervention included manual therapy, including myofascial release, scar tissue mobilization, and ligament releases to reduce adhesions and improve tissue mobility. The patient was also educated on body mechanics to reduce strain on the abdominal wall during childcare and daily tasks. A home program was implemented to maintain abdominal wall flexibility and neuromuscular balance. By the third physiotherapy session, the patient reported an 80% reduction in symptoms, with pain decreasing from 5 out of 10 to 2 out of 10 on the numeric pain rating scale. And she further improved to 0 out of 10 by discharge. Her muscle spasms resolved, and she regained full functional independence, reporting no discomfort during daily activities. She rated herself as completely recovered on the global rating of change scale. These findings highlight that the effectiveness of physiotherapy interventions in managing PRON and suggest that early recognition of neuromuscular contributors to abdominal pain in pregnancy can significantly improve pain outcomes. So, what are the key takeaways and clinical implications? This case report emphasized the importance of considering PRON in pregnant individuals persisting with persistent abdominal pain, particularly when visceral and obstetric conditions have been ruled out. While PRON is under-recognized, it can lead to significant discomfort and functional limitations if left untreated. Targeted physiotherapy interventions, including manual therapy and functional training, may offer a safe, effective, and non-invasive treatment approach. Given the successful resolution of symptoms in this case, Future research is warranted to establish a standardized assessment and treatment protocols for prawn in pregnancy. Clinicians, including obstetric providers, physiotherapists, and primary care professionals, should be aware of prawn as a differential diagnosis and consider early referrals to physiotherapy for patients experiencing unexplained muscle pain during pregnancy. Thank you for your time.